You look 37.
I am 37.
You looked 27 last week.
Hey, don't. No. Ow.
My bad. Thought no meant yes.
Mary noticed the number of ants crawling on her body steadily increasing. She couldn't help but scream. The people in the conference room rushed her to the hospital. When House reviewed her medical records, he immediately concluded she was experiencing severe hallucinations and ordered doctors to administer vitamin injections. But during the injection, Mary suddenly began bleeding internally. The other doctors immediately questioned House's diagnosis. They refused to follow his advice and subjected her to multiple tests. Yet the results yielded nothing. But House knew the answer at a glance. It turned out she was pregnant. However, the doctors dismissed this diagnosis. Hallucinations. No cardiac response. Her pregnancy test was positive because she was pregnant. House went straight to the ward and personally performed a scan on her. The scan revealed a fetus in her intestines, the cause of her persistent bleeding. House immediately scheduled surgery. Despite the successful procedure, Mary's pulse suddenly dropped. She collapsed on the spot. They privately concluded Mary had multiple sclerosis. If lesions damaged her sympathetic nerves, her heart's neural control could explain the bradycardia and blinking, but not vitamin deficiency or ectopic pregnancy. Mary explained all her current issues. Mary developed persistent fever, signaling another diagnostic error. After another round of tests, they discovered an abnormal tissue mass in Mary's intestines. Identifying it as a tumor, they prepared for immediate removal, but Mary's body grew increasingly weak. She could no longer endure surgery, so the doctors made a bold decision. Without any anesthesia, they would make an external incision to examine her abdomen, but the result wasn't the tumor they had diagnosed. After endless discussions, they finally concluded Mary had cancer, so they began chemotherapy. Until House returned to the ward, he noticed something unusual about Mary. He wanted to stop the treatment immediately, but the doctors refused him again. She had lymphoma. Stop the chemotherapy. Her condition was improving. Her bradycardia symptoms were improving.
I need a central line kit, 2 units of packed red blood cells, hypo negative.
Jack used a miraculous serum to awaken John from a decade-long coma. His purpose in doing so was to save John's son. That day, Dick happened to visit John. Jack repeatedly switched the lights on and off to observe Dick's reactions. Last Tuesday, House witnessed Dick stumbling. This was a clear case of motor agnosia, a neurological disorder of visual perception triggered by either genetic factors or latent epilepsy. After treatment, Dick recovered fully. The doctor sought his family medical history, but his mother had long passed away. His father was now hospitalized. He had no relatives or friends. Dick asked his wife to help him get his bag. As soon as she lifted it, the sound of bottles clinking echoed. Opening the backpack, she pulled out a bottle of red wine. The doctor noticed epileptic-like waveforms and concluded Dick's condition was hereditary. Suddenly, Dick felt nauseous. The doctor pulled back his shirt to reveal bruising over his liver area. Immediately afterward, he vomited a large mouthful of blood. Jack instructed them to investigate Dick's family history. He recalled reading a South African report about a drug capable of temporarily reviving comatose patients. Jack wanted to revive John. The director accused him of torturing the patient. Just as he moved to stop him, Jack injected the solution. John miraculously regained consciousness. The director immediately tested John. His brain function was entirely normal. John insisted they had no hereditary diseases, including on his wife's side. The director explained his son's condition. Surprisingly, the father showed no concern whatsoever.